Okay. Um, so, good evening. This is November 12th, and I'm coming to you with another video to um, chronicle the journey of what SLE Lupus does to me. And I thank God that I'm able to journey it here at home because some years ago, these medicines, they were not available for me to bring home. Now they are. So first, I'm going to talk about the first immune suppressant or drug that I take for lupus, and that is this pen. Excuse me, it's called benlysta. I've seen some of my lupus friends in our groups. They've showed the pictures of it. So this is what it looks like, and it has a needle. This is a used one, so but it has a needle, and you stick it down on my thigh, on the top part of my thigh, and then you hear a click, and it is painful. I do that once a week. I used to take this drug at the doctor's office, and so when I was working, I would have to have either take off. Well, always have to take off, or take half a day off, get a substitute come in. It's a whole mess. We'll talk about that in another video. But it used to be available. It still is available in at the doctor's office, but now I have a doctor that allows me to take it at home, simply because I have a little young one, and it's just I appreciate her because she says it does not make sense for me to have to keep coming back up there. But I do it once a week, and I have to let it sit out, time it to sit out to come room temperatures for 30 minutes, and then I clean the injection site and then inject it. I got my lab works back after I had my surgery. So thank God all of my organs are working fine. And that is a true blessing, because with SLE lupus, systemic lupus, things can go from muscles, joints, organs. And it has happened to me many times before, and we'll go into another video on that. This video is about the medicines that I take just specifically for lupus. So as of today, I got my new drug in. It's called rasuvo. It's another injectable pen that I take. And since I received it today, which is Friday, I'm going to start taking it on Fridays. I'm marking on my calendar to remind myself, because sometimes I have lupus fog and I will forget. And then it also helps me to, when I'm writing because I write everything down. I write down my vitals in the morning, which is my glucose, my blood pressure, my temperature, my glucose, and then like once a week I do my weight. So I need to make sure I am keeping track of this, because when I have symptoms, or I'm not feeling well, I need to be able to pull it out and tell my doctors this is what's going on. And like when I had the surgery just last week, I was able to pull it out, explain what was going on with me right before surgery. So let's go into this rasuvo. It's new to me. I don't know how new it is on the market. I did some research on it as far as new in the market, but that wasn't my biggest concern. The side effects. They give this to cancer patients as well. I do not have cancer, but because my immune system is low and I have SLE lupus, I have to keep my immune suppressed. I have to keep my immune system suppressed so it doesn't go haywire. The biggest thing with lupus is that the white cells and the red cells in your body fight. So if you have an infection, the white is trying to fight it to get rid of it, and then the blood is trying. They're supposed to fight together. Well, my immune system does not do that. They fight against each other, and it's very difficult. And so when they're fighting, then that means other things are starting to be systemically wrong. So my joints start flaring, my muscles start flaring, then my eyes, my skin. So that's why I wear these glasses. If you've seen people wear these are called FL41 glasses. These have a prescription in them, and they have a color tint. If you've seen me in the last few years, you've seen me wear prescription glasses and then sunglasses on top. Well, this eliminates me having to wear two glasses at the same time. And I've had people come to me and ask me that, like, why are you wearing two glasses? Or why are you on a cane? Why are you on a walker? Or are you too young to be on that? I can't explain people and their thoughts and why they think that way. That doesn't matter. So now I have to take these two. And with the rasuvo, I'm understanding is that some of the side effects is hair loss, loss of appetite, and dizziness, weakness, tell me not to drive, a whole bunch of other stuff. The hair loss thing kind of threw me for a loop. I'm gonna go into a little rabbit hole here and explain about the hair loss situation. Before I was diagnosed with lupus, I'm gonna tell you, lupus is something that you are born with. No one just gives it to you. They can't cough on you. They can't lick on you, kiss you, anything like that. You were born with this. So when I was about 9 or 10 years old, my parents started noticing my hair was falling out at the very top, like alopecia. And at the time I was eating relaxers. So thought maybe relaxers was messing up. To stop doing that, stop pressing it. Said it was coming out. We did treatments. My sister, my grandmother, they did treatments with me. Hair treatments. Nothing worked. Had to cut it off. So I had a really short cut at the top. I guess what we used to call like that little mushroom cut, and then long in the back. Then it went from there to the back part of my hair would come out. So then we start cutting it up to about here. When I got to about the 10th grade. In my 11th grade, it was up to here because it was coming all out. And by 12th grade, I ended up having to get a weave, a full weave. I graduated with a sew-in. My hair was so damaged. And so a couple of weeks, no, not even a couple of weeks, maybe a couple of days later, that's mommy. And Demetrius is behind me. So they are on board with me. They are my support. They've actually encouraged me to do these videos. And let me show y'all the newest edition. Bring him close. Here is David. David's messing with mommy's medicine. But this is David. Demetrius he's in the restroom. Demetrius Jr. He's in the restroom. Taking his back, just got home from school. So we do the COVID protocols with him. But this is David. Say, hey. And this is David and his finger. David and his finger is letting you know he needs to tell you something. These two are my hearts. And they are my purposes. So the saying, turn your pain into your purpose. Well, these are my purpose. And these are my reasons for living and to keep fighting. Even if they wasn't here. Demetrius is also my reason for fighting. My parents are my reason for fighting. My nieces, my nephew, my sister, my brother-in-law, my brother-in-laws, and my sister-in-laws. And my mother-in-law and my father-in-law. I love everyone that is, and my aunts and uncles, and my grandmother and my grandfather. Well, my grandparents, my grandfathers are passed. I have one grandmother left. Shout out to my grandma Josie. So you're meeting, he's 8 months. This is David. I was gonna do, at least show you how the rasuvo works on me, so I have to wait a little bit, but I just want to talk about it. We had the conversation about if my hair falls out, or when it falls out, because they've already talked to me about that it will fall out. That if 1 or 2 locks come out, then to just go ahead and shave it. So I have prepared myself in my mind that we will go ahead and do that. And since I've had hair loss in the past, and now I know why, it's because of this lupus and what it does to me, then I'm prepared. It's just hair. My health is much more important. So if I'm walking around bald-headed, hey, I'm going to rock that fade. Because, hey, I rocked locks. And I rocked my natural. I rocked colors, so I'm gonna rock that fade. um, but I just want to journey this and document the journey, because these two babies are my legacies, and I want them to know what their mommy has gone through, and will be going through, and I want them to be proud of me. Some people may say, why is she talking about, her lupus and her, you know, hysterectomy, and that's taboo, and we don't say that. No, we don't. But it's time for us to start having that conversation. And if we could talk about the housewives and have reviews on that and all that, well, then we talk about how Kalia is going through what she's going through. And yes, I do watch the housewives and all the other shows and stuff, and that has helped me. It's funny. It's entertainment. But taking medicine is not fun. But I know some friends and family who has called, reached out to me. I'm not going to say your names because that's not fair. And told me, hey, I just found out, and what can I do? What do I do? And I go into, hey, this is what you should do. Embrace it. You have a name for it now. Some people have told me, I'm not embracing, I'm embracing. Okay, fine. I choose to embrace it. I choose to fight. And because I know it's a name, and I know that there are treatments out there, and there are doctors, because I've had to switch doctors over and over again, I'm going to continue to fight because I want to live. And I don't just do prescription drugs. I go to herbalists to get natural herbs and stuff as well. So I'm not all just about prescription medicines and stuff. I'm going to stop now because I need to go and take this medicine. I'm starting to feel I'm already a little pain. I need to take my pain medicine from surgery and stuff, and I need to put David down. He's a little heavy. Today, David went to the doctor today. He has a little cold, a little virus, and he has a rash. So I have to keep him protected as well as me. So that's why I need to take this medicine. But he is 17 pounds. My baby is 17 pounds, and he is 8 months, and he is trying to walk. Matter of fact, David doesn't even want to crawl, and he wants to try to talk. He's trying to make words. You giving kisses today? Did you see with that finger? That's his. That's his little finger. So like, share, and comment on this video. Go to my YouTube channel. Subscribe to that. It's free. It doesn't cost you all anything. But it helps me out so we can get the word out. I'm also going to start a lupus walk team soon. So I'm going to let you know the information for that. We can sign up to start doing that. I'll explain how that goes. But if you are willing to go through this journey with me, and some of you are, I don't have to question it. Support me. Like and subscribe to this video. Go to my YouTube channel because it will go straight to it. And subscribe there and listen to the updates. There is my 10-year-old. This is Demetrius. Demetrius is going to start his YouTube channel. Matter of fact, let me start off by saying this. Demetrius encouraged me to start doing this because he wants to do it. And he walked me through it. So these are our legacies. These are Demetrius and our legacies. And so we are going to get this done, and we're going to start working on it. So let me stop the video. I don't like for it to be too long. See you in the next one. God bless.